Okay, so it's 3:01 now. I'm sure others will continue to join us, but good afternoon and welcome to this National Health Literacy Action Plan listening session. My name is Joshua and I'm joined by my colleagues Lana and Dr. Bishop. And today we'll dive into the National Health Literacy Action Plan and gather your thoughts and feedback on how this plan has worked for you and next steps for developing the next iteration. But before we get to that, I wanted to first introduce our presenters for today. So as I mentioned, my name is Joshua, and I am a Health Communications Fellow with the U.S. Department of Health and Human Services at the Office of Disease Prevention and Health Promotion. I work with Dr. Jennifer Ann Bishop on the Health Communications Prevention Division, supporting our office strategic communications, including website development, social media communications, and our health equity work. I'm joined by my colleague, Lana Moriarty, who serves as a senior advisor in the Office of Policy at the Assistant Secretary for Technology, ASTP, at HHS, and she's a co-lead with Dr. Jennifer Ann Bishop for the HHS Health Literacy Work Group. Lana works to educate and empower individuals via technology to be active and an equal partner with their care team members in decision-making and managing their health and wellness. And Dr. Jennifer Ann Bishop is the Communications Director for the Health Communications Prevention Division at ODPHP within HHS. Alongside Lana, she co-leads the HHS Health Literacy Work Group and also serves on the steering committee for the Society for Health Communication and is a member of the National Academy of Medicine's Community Advisory Group. Her research focuses on leveraging health communications and health literacy to reduce health disparities. And so we're excited to have you all here to join us for a deep dive into the National Health Literacy Action Plan and how it has served you as a tool in the past and what HHS can do to update the tool so that it can continue serving health literacy researchers and practitioners in the future. But first, we want to take a moment to get to know you all. And so with that, we'll start with some icebreakers. So feel free to type into the chat your answers to these icebreakers, and I'll try to monitor the chat and read those out as they come in. But our first question or icebreaker for today is, if you could add a word to the dictionary, what would you add and what would it mean? So I'll give you a couple seconds to think about that and type that into the chat. And as I mentioned, I'll try to read that out as we go along here. Okay. So I see latrocultural from Michael. Thanks.
Iatrocultural.
Gotcha. Oh, you can come off mute. That's also another option. Feel free to come off mute and share your word as well.
Iatrocultural, ever pertaining to the culture of the clinicians themselves.
Thank you. Any others? Again, feel free to just come off mute and chime in.
Well, I'll come off mute, but I'll admit that my word is not as relevant, but it's a word that my family uses, and it's mon scribble. It's a Barbadian word to eat voraciously. And my brother and I used it the other day, and I'm like, it's just such a perfect word. So that's my contribution.
Snack accident. When you eat all of the snack by accident. Thank you, Tracy.
Snackcidents definitely should be a word.
I love that. That happens frequently in my house.
So just want to keep us moving along. So our next question here is, if you could pick up a new skill in an instant, what would it be and why? Thank you, Aman. I see you typed in bother nation. Well, my family says to describe a specific headache that they are blaming on someone else as the cause. Thank you. AI prompting. Thanks, Sean, for their instant skill. Being better at improv. Thanks, Esther. Other languages, teleportation. I like that one.
Tracy
And
is
so,
winning.
yes, she's winning for today. And so for our last icebreaker question, in one word, how would you describe health literacy?
Well, hold on. We have quite a few other
Coming in.
additions. So
Yes.
we have all languages, so multilingual, master multilingual, apparition, and surfing.
Surfing.
Very nice.
Oh, for sure. Give folks a second to think of this one, and then we'll move along. And feel free to just type. But thank you for participating. Before I turn it over to Dr. Bishop, I wanted to quickly share with you all the rest of today's agenda. And so that first section was really just a welcome introduction with these icebreakers. But for the rest of the session, we'll really be diving into the National Health Action Plan, Health Literacy Action Plan. And then we'll have a prolonged discussion or opportunity for folks to kind of chime in with a number of responses to the questions that we are posing with regards to the National Health Literacy Action Plan. And then we'll have a wrap-up session where I'll kind of go over some of the main points that I have summarized throughout our discussion today. And then Dr. Bishop will lead us off with next steps with regard to how we'll go about updating the National Health Literacy Action Plan. And so with that, I would like to turn it over.
Thanks. And Joshua, please call me Jen. I promise you, everyone, he does not call me Dr. Bishop in the office. So first, I wanted to just thank you all for joining us today. Your feedback this afternoon is going to be critical to the work of the U.S. Department of Health and Human Services. Wanted to begin by telling you a little bit about the HHS Health Literacy Working Group. The group is comprised of all operating and most staff divisions under HHS, and it's met regularly since 2003. So that's over 21 years of doing this work. Now, the work group collaborates to ensure that improving health literacy remains a priority for HHS. And oftentimes we share resources, we work together to tackle difficult problems. And by and large, the work group strives to create understandable and actionable health information, support and facilitate engaged and activated health consumers, and refresh the health literacy science based on a regular basis. Next slide, please. So this spring, our health literacy work group sat down, took a note of the work that we've been doing, and we really wanted to give our work a bit more direction. So we met and developed 5 overarching goals that will help guide the work of the work group over the next 4 years. So I just wanted to share these goals with you today, but we'll be focusing on goal 3 primarily as part of our conversation. Now, goal 1 is to increase the awareness of and application of health literacy best practices in federal communications. Goal 2 is to establish and field a national measure for personal and organization health literacy by fiscal year 2027. And I just wanted to be very clear that national measure for personal health literacy. We're looking to identify one that is objective because we are very well aware that there are quite a few subjective measures that are out there. Goal 3, we're looking to develop a set of shared resources to improve the application of personal and organizational health literacy principles across HHS, but also across the nation by FY 2025. Goal 4, we're seeking to create opportunities for the work group to network outside of our monthly calls. So we're building camaraderie with each other. And finally, goal 5, our work is really going to be dependent on the funding, but support of our leadership. So it is a priority for our team to increase agency leadership and public awareness of health literacy. Next slide, please. So as I mentioned, with our focus for today's conversation is going to be for goal 3. Which speaks to developing a set of shared resources. And the shared resource that we are looking to begin focusing on is the National Action Plan to Improve Health Literacy. Not sure if you're familiar with it, but the plan was published back in 2010, and it was conceived originally as a comprehensive resource for individuals, communities, policymakers, and cross-disciplinary efforts to engage health literacy promotion activities. Now, the plan itself has a set of core principles, and there are actually 2 of them that I just wanted to highlight to this group. The first is that all people have the right to health information that helps them make informed decisions. And the second one is that health services should be delivered in ways that are easy to understand and improve health, longevity, and quality of life. Now, the action plan is separated into 7 goals, and I just wanted to refresh your memory if you're not as familiar with them. And we're going to be talking about these throughout the process or throughout this listening session today. So the first goal of the action plan is to develop and disseminate health and safety information that is accurate, accessible, and actionable. The second goal is to promote changes in the healthcare system that improve health information, communication, informed decision-making, and access to health services. Third goal is to incorporate accurate, standard-based, and developmentally appropriate health and science information and curricula in childcare and education settings through the university level. 4, to support and expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services in the community. And 5, to build relationships, develop guidance, and change policies. Our 6th goal is to increase basic research and development, implementation, and evaluation of practices and interventions to improve health literacy. And our final 7th goal is to increase the dissemination and use of evidence-based health literacy practices and interventions. So your task, if you choose to accept it, is to assist us as we look towards revising and updating the National Health Literacy Action Plan. Now, as I said before, as part of our strategic plan, we wanted to focus on improving or revising the Health Literacy Action Plan, but we recognized early on that this plan is a resource that's not just for the federal government, but for everyone. And so we felt it was really important to begin with an assessment of sorts, going straight to you, researchers, public health practitioners, also partners in the field who help us with this work, to hear your voice about the plan itself, what you liked about it, whether or not you're even aware of the plan, and what you might want to see different in the future. And so for today's session, we would like to talk to you a little bit about the plan and cover some of these high-level topic areas. So as I mentioned before, your awareness of the plan, how you've used the plan, as well as the plan's strengths and weaknesses, because we are interested in potentially, and forgive me for not advancing the slide, we are interested in potentially changing the format of the health literacy action plan to make it more usable for you, the consumer. So we really want to hear all of your thoughts on how we should go about updating and improving this document. So before we begin soliciting your feedback, I just wanted you to, maybe by a show of hands, or maybe even inserting something in the chat. Can you share with us how many of you are aware of the National Health Literacy Action Plan and whether or not you've used it? I will pause, but while I do so, I'm going to hand the virtual mic over to my partner in crime, Lana Moriarty, to complete the Q&A the information section of our session.
Thank you, Jen. So I'm seeing a lot of hands, which is really encouraging. I can't see the full, I can't see all of you. Let me see if I can change my view. But it looks like we have a lot of people that have experience with this. So as Jen said, we're looking to get your feedback, finding out like what kind of awareness there is about the National Health Literacy Action Plan, how it was used, its strengths and weaknesses, and then the what kind of format you think would be most useful. So Joshua and Jennifer, can you see how many people did have their hands up or do have their hands up? I cannot see everyone.
I think at maximum, we had maybe about 4 or 5 people with their hands up. And then I think we had a few people in the chat who've identified that they're aware, but we also had a few who were not aware. So this is a great opportunity for us to introduce it to you.
Great. Okay, well, why don't we move to the next slide and we will get this discussion underway. So as Jen said earlier, I think really when we sat down to think about the plan, and you know, this was more than a decade ago that it was written, and we know that there have been, you know, people that have used it and referenced it, but before we move forward in some way of updating it, we really wanted to make sure we engaged with public health professionals, with researchers, with educators, and a variety of stakeholders to figure out, you know, what would be the most useful version of a national health literacy platform or plan. So you all said you were, some of you are familiar with this. How could you put in the chat or come off mute, but how did you come to know the National Health Literacy Action Plan? If you are aware, what has been, what was the way that you were familiar with it, or how did you find it? And I'll give you all just a few minutes. Okay, so I'm seeing some in the chat. Aware of it, but didn't use it directly, except as a citation. I know there are many researchers have mentioned that to us. Okay, from the Minnesota Health Literacy Partnership, great. Through our organization's statewide programming for, is that Pennsylvania Health Literacy Coalition? And then learned about it at numerous national health literacy meetings, conferences, and okay, that's excellent. So I think that I'm really happy that it was, you know, obviously widely disseminated and discussed at a variety of conferences across the country. Oh, and Tracy even says that we have all of our new staff and interns read it. Excellent. That's really good to hear. So I don't know that it's a good question. Danielle has a question. How was the National Health Literacy Action Plan attempted to be disseminated? And I think that much of that was done through conferences, but I don't know because Jennifer and I weren't involved with it. I think we'd have to go back to the original author and get more information on that. Jennifer, do you have any sense of that, of how it was disseminated?
No, I think you're correct. I believe it was disseminated primarily through conferences. And it's a product that we like to highlight here at ODPHP as one of our many resources that we have available to assist with getting people on board and learning more about not only what health literacy is, but also how they can be part of addressing the issue.
And I really like Robert's response. Used it to persuade the doubters that health literacy was an HHS priority, which, as Jennifer said, is really one of our core principles of the work group that we both chair. Really making sure that health literacy stays front and center as a priority for the department. Tracy, let's see what we said. We used it as a guide when we were reviewing health literacy policies at our institution. Great. So I think this is a perfect segue because you guys are already moving into the next question of how did this national plan impact your work? So it sounds like that, you know, obviously some people are using it as a guiding document for new staff. You know, as a persuasion tool, as something to show people that there is, you know, validity and importance to the work of health literacy, and then guiding those guiding principles for health literacy policies. So let's see, using it in learning collaboratives, and feel free, Marianne or Diane, if you guys would like to come off of mute and talk about this, we're happy to have you all, you know, talk about this a little bit. So I think Marianne, you talked about using it in learning collaboratives with more than 20 external organizations. That's fantastic. Was that also at a conference, or was that just something that you all did internally and then invited organizations? Or like an internal meeting, I mean?
I led those as part of the OMH health literacy grants the last few years,
Okay.
and in our
Yep.
county, Franklin County, Central Ohio. And we collaborated with
Fantastic.
external health and health related, like public health, community-based organizations, not just healthcare delivery entities.
That's excellent. And I think we probably have a lot of those stories because there were so many, I think there were like 70 communities that got the grant. So there are a lot of probably rich lessons learned there. Let's see, there's a question from Diane. Does the action plan include recommendations for training and capacity building? I don't recall. Jennifer, do you remember if there's capacity building built into that?
Not specifically. We do have a section on partnership building, and I think I've definitely made a note of that question, or actually maybe even that recommendation as we start thinking about the revision of the document.
And Michael, I think do you have something? Is that your hand up?
Yeah, you know, an interesting thing happened when it came out. I knew it existed. I mean, I had talked with Rob in various contexts and other people too when they were building it, but when they were developing it. But when speaking in other countries, you know, I remember very explicitly giving a talk in Australia. This also happened in several times in Kuala Lumpur. It also happened in Germany. It also happened in England. All these places I went, they assumed that because you guys put out this action plan, that it was the plan for the United States, that it was the plan for the country. And it wasn't until I heard all these other people from all these other countries asking me questions about this that I come back and say, hold on a second, how come the Joint Commission doesn't know about this? How come the AAMC doesn't know about this? How come the American Hospital Association doesn't know? Like all these different entities. And there was, yeah, so some of us then tried to bring it around to these different places, but it would have been awesome to have a lot of these types of entities involved more, committed more, brought in more from the beginning. And
Yeah,
then
I fully
and then
agree.
committed to the goals as well. Everywhere else in the world that I went, they assumed we had already done that.
And
Wow.
admittedly, I think as we're thinking about the revision, our goal is to ensure we're getting feedback, not only from, again, people who are familiar with health literacy and members of our community, but also engaging practitioners, engaging librarians and others. So they can, again, we can get their feedback, but also they can help brainstorm with us, one, what this document will look like, and what format it should be in that can be useful for them in making the case that health literacy is an issue that should be addressed, particularly if it's in a field that people don't normally think has an impact on health literacy. So that is definitely one of the plans that we have moving forward to make sure that this process is going to be one that's very inclusive.
Yeah, and to that, in that regard, I think, Michael, you're right. Like, you know, if we are really mindful about how we do it, I mean, having all of these different organizations involved, you know, not only, you know, puts it at a different level, but really creates that buy-in that we would want. I mean, we're not updating it just for the sake of updating it. No one wants us to just sit on a shelf, right? And be, you know, we have a million of those documents. But I think that, you know, if we're going to undergo this effort and do it right, I think we have to get everyone involved. So I appreciate that comment. And also, I think, Sarish, I hope I'm saying that right. The national plan has and will continue to inform a lot of our regional and statewide health literacy efforts. That is definitely the idea, that we want to update this so it is more of a you know, living document that will continue to inform those different health literacy efforts. Let's see. We used it to show how health literacy could be implemented in different sectors. There were some examples. Sabrina, do you want to talk about the examples or give us any of those in the different sectors you mentioned? I would love to hear about that. And if you can't come off mute, that's fine too. You can also put some of those in the chat. Let's see.
No, I think I can come off mute.
Yes, I can hear you now. Yes.
Okay. I just remember there were a lot of examples. And I remember, you know, I haven't looked at the document for a long time or for a while, but it also showed that health literacy could take place in multiple sectors, in different sectors, in education, in healthcare, in research, in the community. So anyway, that is my comment. I thought those were useful.
Yes. And you were, sorry, I misunderstood. You were talking about examples that were in the plan. Is that what you meant?
Yes,
Okay.
exactly.
Understood. Thank you. All right, let's see. And Jennifer has a link to the executive summary there for any of you who want to click on that. Then we have Robert, the National Library of Medicine, set up an internal health literacy coordination committee. That's fantastic. Does that continue today, Robert? That would be great to interact with them.
I actually don't know. I
Okay.
retired from there 3 years ago.
Okay.
My
Happy
understanding
retirement.
is that
I don't
does.
know, but as long as I got the floor, go on to the next thing, I think what you need to know is that during the 10 years after the document was developed, there were a lot of HHS agencies, some big ones, who were unaware of it or pretended it didn't exist, or their leadership changed and they said, we're not obligated to follow this. And that was very disappointing I think, to those of us who helped develop it, who were inside the agency. Okay. They're really, and again, Michael's comments about nationally, internationally plan, I agree with those, but that's exactly my experience. But nevertheless, the thing that really disappointed me the most, and I think some of the insiders, was what about, and I'm not going to name the name, but there were several significant HHS agencies that they were either never at the table, or they decided that they could just deflect the whole thing.
Yeah,
So I'd
which
like-
again goes back to the original comment of buy-in too, and the importance of really trying to foster that as we go through this.
Anyway, to be
Jennifer,
positive,
Michael?
the reason I'm telling you these things is hopefully don't make the same mistake, or try to avoid them. Okay.
Thank
That's
you.
really helpful. And one thing that at least I find inspiring is that in the last two HHS strategic plans, health literacy was featured prominently. In the most recent plan, which runs until 2026, health literacy is highlighted as a overarching priority, which means that theoretically, every agency, every staff division should be thinking about how their work intersects with health literacy and what they could be doing to improve accessibility to health information. And so I think it's something that our work group is looking to ensure that agencies are staying engaged. But I think at least from the highest level in HHS, it's apparent that they do believe health literacy is an important issue. I think it's not only up to the work group, but also people like you in the field to help remind us that we could be doing more to support your work on the ground. But I did want to make sure that we conveyed that, at least in the last few years, it has definitely been a priority issue.
And I just want to go back to Robert and then Michael. I think you may have had a comment on what he said, but Robert, you mentioned for those of us that were involved, can you talk a little bit about how you were involved with the plan, or just was this just kind of consultation as it was being written, or were you actively involved? Okay, Robert, you're on mute if you're talking.
Apologies. I was actively
No
involved
worries.
in part two. Not the inaugural.
Okay.
And I represented the National Library of Medicine.
Okay, perfect. Thank you. Michael, do you have some thoughts on that as well? It looked like you were going to say something, so I just wanted to give you the floor before we move on.
No, it just I'm grateful that you're putting this out there. Basically, it sounds like an invitation for people to provide feedback and engagement. That's fantastic. That did happen in the past as well, although I don't know how many people, actually wrote in. I did, others did, I'm sure, but also, there were some real champions who were engaging people. Rob was engaging people, Cindy was engaging people, Cynthia was engaging people. Like, there were people who were reaching out in their own ways and involved in various fora for people who are more on the research side, people who are more on the implementation side, all kinds of different parts of this. It's a big beast. It's really big. And it was really interesting when at one point I gave a talk, and somebody said, well, but HRQ has a toolkit. And I was like, that's right. And they were like, so all the hospitals in America use it, right? I was like, you understand there are like over 5,000 hospitals in the United States, and we're trying to get a few of them going, so there's
Yeah.
But I think getting a lot of stakeholders at the table would be fantastic.
Good. And just so you all know, I'll put it in the chat as well, but Jennifer and I are holding another listening session at our annual meeting in Washington, DC, ASTP. So we are holding that on December 5th, I believe. I don't have the time in my head, but I will put that in the chat. If any of you are in Washington and you want to come meet with us in person, we're also just looking at, you know, this effort, but really the tie-in with health equity and patient access. And, you know, I think I have for years, really with many people that know me at formerly ONC, now ASTP, really talked about data, but not just data for data's sake. You know, people have to understand the numbers you're giving them. And if it's not useful, then we're not doing our job. So I'm constantly saying that about interoperability and all of these big words, because we are jargonistas at my agency. So I think we would love to have some of you there at our next session in December, if anybody is available. So I appreciate, Sarish, you also talked about the recommendations and strategies that you found those very useful, and really, you know, trying to advance organizational health literacy on a very large scale. We do have a question, I think, from Rael. Rael, did you have your hand? Yes, you have your hand up. Go ahead, you can unmute yourself.
Thank you. Sorry, it's actually not a question, but a comment that I think the US 10 years ago is not the current US. In 2024, that's what I would say. A lot has changed, there are a lot of dynamics. And then another important thing that I would like to point out, I think many people look at health literacy just at the patient level, but what about prevention? What about thinking of preventing all these chronic diseases? I think that's a very fundamental point, that we should also think of prevention efforts in terms of health literacy. I just finished conducting my PhD dissertation. It was a qualitative research. And I think one of the feedback that came out in terms of cancer education is that I think many people get cancer health information when they go for treatment, but before treatment, no efforts are being made to really provide information to empower people to make informed health-related decisions. So really thinking of all the key dynamics, what has changed? What is it that we can do differently? And I think that also, I mean, facilitating another assessment, which I had alluded to, can be a very, you know, can serve as a base in terms of really identifying who are the key stakeholders and what are the key needs that, you know, we really need to prioritize going forward, just to really ensure that this is what happened 10 years ago. This is where the systems are in terms of, you know, supporting all the health literacy efforts in the US and charting a newer way forward in terms of engaging all the key relevant stakeholders in research, you know, community partners, which I think integrating that voice is really, really important going forward. And also just of the key in terms of, you know, healthcare providers and, you know, program staff who lead multiple efforts on health literacy.
That's a fantastic comment. Thank you for that. I think that you're right. What about prevention? I think that you made me think about years ago when I did my graduate work at University of Maryland. The APHA organized advocacy days where they actually trained people to go on the Hill and meet with legislators, and we prepared pitches depending on where we were, and it was really empowering to look at you know, what dollars spent on prevention could potentially do. So I think advocacy may be another area along with prevention that we want to highlight. But that's really excellent. Let's see. I think we've talked about that. Okay, I'm just seeing what else is in the chat.
Can I just ask to follow up Sean's comment here? You know,
Sure.
The business about the NAL, you know, from 2003, you know, it's more than 20 years old. So, you know, that's a huge program. It's a huge project, you know, a national assessment program like that. But there's no talk of that?
There is, and it's something that we've been working on in the background for, I would say, at least the last 18 months. Our biggest hindrance has been getting financial support. We're happy to report that in the last couple of months, we received a modest sum to have our contractor Communicate Health work with us to identify some potential measures as well as a strategy a strategy on how we may want to go about integrating an objective measure into an existing federal survey. So we're making slow strides, but our group definitely sees that this is a critical area that requires our immediate attention. I think our biggest challenge right now is getting the funding to support that effort. We're hoping that we'll have some feedback in the near future to build our strategy. And once we have that information, we'll share that with you.
And I want to just touch on this comment from Sandy here. And Sandy, I don't know if you want to come off mute and talk a little bit about this, but she was saying that the format of the original plan was loosely modeled on some of the Surgeon General's calls to action, and had hoped that the SG would put out then a call to action after the workshop on health literacy in 2006. So some of the format of the action steps by sector was modeled after this. So, I mean, I think that's also, to me, a really great piece of this is, you know, having calls to action, having things that are very, very easy to implement for people, you know, at different levels. I think that's a really key point. But
Yeah,
Sandy, do you want to say anything about that? Go ahead.
Sure. Yeah, I mean, this is going way back at this point, but we, back in 2005, 2006, we did do a series of workshops across several locations across the country that the Surgeon General, along with coordination with several of the health literacy working group members at the time and ODPHP, and we're collecting input from communities around you know, what they were seeing in their community, what kind of action steps, you know, what kind of support did they need, you know, that kind of thing. And there was proceedings published from that, and we were hoping it would be used as sort of an impetus for the Surgeon General. And when they decided not to go that route, I think that's kind of started the impetus of this action plan, is that the Surgeon General didn't end up putting something out, and so wanted to have something and use some of the things that the Surgeon General often puts out in terms of really having specific action steps and and all that way from individuals all the way through systems, I think was inspired by that.
That's really good to know. Thank you for that background and the context. Are there other comments on that? I love that Tracy put into ChatGPT, which now I think we're using it for in a number of different ways, that asked what recommendations it would give for updating the document. And it had really good ideas. Also asked to develop a plan for distributing a revised version, and had great ideas. So yeah, again, you know, AI is you know, in our lives in many different forms and helping us. So I fully expect that is something we can definitely, you know, look at what are the suggestions. Let's see, what else? Danielle, this is a great question from Danielle. So what has been done to get buy-in for standard implementation at universities? I do not have knowledge of that, but we are in touch with the original author as well, Cynthia Bauer, and she's given us a wealth of information of how you know, they did a lot of different groups, but I would love to, you know, hear from people that may have knowledge of that. I mean, as she goes on to say, students learning plain language from the get-go would be instrumental to changing the field. So do any of our researchers on this call want to respond to that? Okay. I'm just going through. Yes, I fully agree with Sean's comment. We can't keep relying on outdated data being quoted from the 2010 plan or from the 2003. Is it the null that was in 2003? Yeah. So I think that's really that is also a big motivator for me for us to get more current data and figures into a new updated version. So let's talk a little bit about how like let's move to we've talked a little bit of how this impacted your work, but let's talk a bit about you've seen the goals, or we've heard the goals, the 7 goals that Jen went through. How do you think that this impacts your work with those goals in mind and with that overlay, but also then who is our primary audience in your opinion? So I think we really want to touch on, who are we doing this for?
And feel free to speak up. You can unmute yourself or leave a message in the chat.
And there are 58 of you on this call, so I know that probably a lot of you have things to share. Okay, so I obviously, we've talked about a lot of different stakeholder groups. I think many of you on here are implementers and researchers, perhaps educators. You've worked in federal agencies and worked in other private sectors. So is there a primary audience, or are there many stakeholders across the board? Why don't we break it down a little bit?
So we
Okay,
have,
so yeah, go ahead, Jennifer.
no, I was going to say we have a message from Dana Barbie, and she would love to see more specific guidance for insurers and drug manufacturers. I also see that Suresh had left a comment, and I think this is really more focused on the content, but she would like us to address issues or develop a call to action as it relates to digital health literacy for healthcare organizations. So healthcare organizations being an audience, given the utilization of technology, telehealth, patient portals, that's right up your alley, Lana, especially 2020.
Yes, definitely speaking my language. Okay, so let's see. We have 2 new messages. Okay, how do we share this plan with accrediting bodies to move towards policy requirements for requiring health literate communication as part of certification requirements like the Joint Commission? Yeah, I mean, I think that's one way to ensure that this actually happens, is to get it built into policy. I mean, that's what we do with certified health IT, is in our rulemaking. Important to ask who the beneficiaries of the plan are. Very good point. I appreciate that. Does anyone wanna talk about the beneficiaries of the plan? Diane? Or Robert or Michael? I'm just gonna start calling out names.
Well, this topic is so cross-cutting. That's part of the issue here. There's so many places where it's relevant, and there's so many beneficiaries. I mean, it's hard to know where to start, but at least there are some things that you might have more power to do just more directly. I'm not saying that just as an example, like AHRQ said for itself, for their own grantees, that they put out a informed consent toolkit. They said, if we fund you, you must use this. So this thinking through the ways that HHS, which is quite powerful and quite big in and of itself, could plausibly exert its own power for its own fundee, grantees. that would already be quite impressive. You know, that's a whole conversation, like many ways that might play out. So just throwing out there that it would be, I would be enthusiastic if HHS would exert its authority to have a little more power in this conversation.
Right, and just looking at all the levers, right? There are numerous policy levers and we've touched on in this conversation. So I really appreciate that example. I think that's one that we will definitely focus on. Other thoughts?
Well, I can talk about a missing lever, a lever that I heard was missing for years. I don't think it was, but it was at least perceived that way. Some critics of the plan often would tell me, and some others who were involved in it, that we never even bothered to touch on health education, K through 12. And they basically said, why not? And they said you have leverage there, even though you're not the Department of Education. And that, to me, that was always an example of the kind of leverage that an impact that you can have if you really bring all the stakeholders to the table, and then you think through, how do we sustain leadership among them?
Yeah, that kind of
Right, right.
that kind of intersectoral work has been done in some other countries,
Yes.
but it hasn't really happened in the US. There are countries like Germany that have a primary education requirement in health literacy, and some other countries too. But that only happened because of an intersectoral relationship between the health sector and the education sector and things like that. But now we're making your job even bigger.
But I think it's really important. I mean, you know, from my health IT background and standpoint, you know, when I got into the sort of patient work and looking at patient access, some of the decision making that was happening, you know, for patients was involving the head of the IT, maybe the you know, the person that was making decisions on the IT side, but the person's you know, doing the record management or actually, you know, involved with like the processes wasn't even at the table. So, you know, things like that, when you realize, when you get down, because you're thinking, okay, I'm looking at this and why are these two things so disparate? And it's because the right people, both sides of a particular decision making and processes are not at the table. So I think that is a really key point that we will take away from this. I know we don't have a lot of time left, so I'd like to talk a little bit about format. I know we touched a bit on this, but just wanted to Diane has a question, and then we'll move on to that. Diane.
Sorry, I lowered my hand because I thought you were moving on, but I just wanted to give a point of information that regarding the German-speaking countries, particularly Austria, the reason they were able to get a national action plan is that they were doing so poorly on national measures of health literacy. Interestingly, in the HLS EU survey, they were doing a very poor job as compared to other European countries. So that gave them leverage for the government to say, we need to have a national action plan. It was part of their strategic goal, the governmental strategic goals. So in a sense, the national measure, which was low, worked to the advantage of getting a plan going. It's just an interesting thing to think about. And also it supports what you've been speaking about, is repeating a national survey for health literacy, whether
Right.
you call it objective or not objective, whatever. It's a good idea to think about it, because politicians listen to that.
It's true. And yes, and those numbers do speak volumes. So thank you for that example. So I know I'm trying to monitor the chat as well. I think we have a lot of good ideas and comments in the chat, but I do want to take just a few minutes to talk about format. So, you know, there is the possibility of not doing a full national action plan update as it exists, as the plan exists. But if you, you know, had your, you know, I guess magic wand or whatever to create whatever you think would work across the country, I mean, what do you think format wise this would look like? Or what speaks to you? Or what do you think, you know, and I mean, Rael said it perfectly that this is not the US of 10 years ago. And we know, you know, that things have changed in so many areas and so many sectors, and certainly with you know, health information and digital, you know, looking at digital literacy, looking at access and whether a person is accessing something in a clinical visit or accessing online from their home. So I just want to pause there and see if we had somebody says embedded. Oh, and I think I'm not reading the full comment, Michaels. You caught me with the microchip.
No, you're not supposed to read that out loud.
All right. So, but I would like to see if you all have strong feelings one way or the other about format, about the way that we might move forward in that way. And obviously this is, you know, a long road ahead of shaping this with a variety of different people and maybe even different departments. So I'll pause there. All right, so I know that Danielle has a comment. Can you frame it as learning how to communicate effectively to people with varying levels of health literacy makes you a better health practitioner? That is a very good point, because I think that you know, we have to have something that also speaks to the provider, practitioner, clinician side. Not only will health outcomes be better, but they will be better able to diagnose by a better understanding of people trying to describe symptoms. More interactive format would be great, where you can customize a plan for your organization's audience and objectives. I think that's an excellent suggestion, Sandy.
And I would say that Sandy's possibly reading my mind. I was thinking of an example to share, and I said, you know, would this look something more like our current healthy people format, where people can personalize based on the kind of organization, but also the audiences that they focus on. So just another thought for format. Now, I do recognize that we're getting close to 4 o'clock. I just wanted to highlight that if you have additional thoughts, because this hour went exceptionally fast, and thank you all for your excitement and energy around this issue. I've input our email addresses in the chat, and please feel free to reach out and share your thoughts with one or all of us. We really are interested in what everyone has to say, and I'm excited about working with you.
Thank you.
And I am, yeah,
Sorry.
I'm putting in right now the our annual meeting information, just for those of you that might want to take a look at that and register. But I'm thrilled to have so many of you here today. I know Joshua, you were going to wrap us up, but I'm not sure if you can do it in less than a minute. But I just want to thank all of you for your thoughts. Any overarching thoughts to close us out, Joshua?
Sure. So I think a lot of what has been discussed today is an emphasis on cross-sector collaboration, but also specifically looking at what we can do within HHS to collaborate with agencies to be sure that leadership has buy-in with the Health Literacy Action Plan and enacting goals within their own agencies, so that we can kind of move forward as a collective voice, so that that cross-sector collaboration has a direction to move forward for. So.
Excellent and very succinct. I appreciate it. So as Jennifer said, please don't hesitate to reach out to us. And we really do want to hear from you all in the future. And we will, you know, likely come back to you as we move this forward.
And one last thought, we are going to hopefully do some additional listening sessions and potentially may put out a request for information. We'll make sure that we share it with all of you. So there'll be additional opportunities for you to share your ideas. And we've collected some information from some of you, and we'll also follow up with you just to hear a little bit more about some of your thoughts. But thank you again for all of your help and your excitement. Alana, please take it home.
Yep. Excellent. So we have to jump into other rooms. There's two
Yes.
other rooms now for the almost last session of the conference. Thank you, everybody. Be well. Hope to see you in the other rooms now.